Hello, my name is Deborah Chambers. I'll be discussing breast cancer care at Kenyatta National Hospital in Nairobi, Kenya, a qualitative study. What happens when a small group of global health researchers meet together to carry out a joint project in an underserved community? In February and March of this year, I had the privilege of leading a global health qualitative study that focused on breast cancer care at Kenyatta National Hospital in Nairobi, Kenya. Several Kenyan hospitals lack the needed resources to care and treat breast cancer patients. The gaps in breast cancer care and treatment are usually very wide. Women present at this hospital when their cancer is mostly advanced, usually between stages 2 and 4. Kenya is located in East Africa, and Kenyatta National Hospital is the largest hospital in East and Central Africa, so it serves a very wide population of patients. This research aimed at seeking answers that will allow us to understand the wide gaps in breast cancer care and treatment. Most of the women seek treatment for radiotherapy and chemotherapy at Kenyatta National Hospital, and they will come in with their family members for support, and sometimes it takes a very long time before they're seen, or sometimes they'll even leave to go home without being seen by the doctors. We used qualitative study method for this research, and convenient sampling was used. We received the informed consent from both before the interviews were conducted, and ethics approval was received from both National University and IRB office in Nairobi, Kenya. So overall, we found out that the costly treatment procedures and also accessing the care at Kenyatta National Hospital is very expensive for most of the patients who come in. And transport is also a problem. Some cannot afford to travel from their homes. They travel for 12 to 14 hours at a time. So it takes them a very long time to get to the hospital. We have the medic strike whereby the nurses and the doctors decide to go on strike. And when they go on strike, the hospital can be shut down. Businesses don't happen. Patients cannot seek care. They cannot be seen by anybody. So most of the time, the patients will just stay at home without getting the care and the medication that they need. And also we have shortage of medication at Kenyatta National Hospital. The patients will come in, see the doctor, but then they cannot access any medication. So that means their treatment and care is hampered, and they go for days, sometimes weeks, without getting the needed medication. We learned from participant 1.5 that money issues made her wait for a long time before she could seek the care and treatment that she needed. And the doctor initially misdiagnosed her, and she was told that contraceptives were what caused the lump. Financial difficulties are also very common. Money is always a problem, and the machines keep breaking down. So sometimes the patients can wait for 3 months before they can see a doctor. We also learned from participant 1.2 that patients opt to sleep on the benches instead of commuting every single day. So if they have an appointment to come see the doctor after 2 or 3 days, they decide not to go back home. They'll stay at the hospital and sleep on the benches in the cold, sometimes without food. And it's a very terrible situation for them. It makes them even worse. Prolonged wait times also happen before they seek care. The queue is always too long, so patients decide to leave home as early as 4 a.m. to come and see a doctor. 43 participants were interviewed mostly in Swahili language, and the ages were between 18 and 80 years. Some had high level of education, while some had none, and some had very low. And all the women had children, and some women still breastfed even after discovering they had a lump. The limitations that we found in this study were translation errors during the interview and during transcription as well. Population did not represent all of the women who have breast cancer. So for the conclusion, I found that more underserved areas in Kenya need to have access to breast cancer care, and they also need health education literacy, because a lot of women do not know what to do when they have breast cancer. When they discover a lump on their breast, they do not know what to do. They think, well, it's probably milk. I was breastfeeding. It's just milk that's there. It's going to go away. Or maybe I'll just take painkillers and all my problems will be solved. We need to collaborate with other stakeholders. We need to develop global leadership. We have to encourage other people, other students also at National University. We encourage them and train them so that they can be able to take up their places in the global arena and be able to influence other people and teach them about health care. And more cancer research is also needed to be able to discover more about breast cancer and teach other people. So I chose this topic to talk more about collaboration to foster global health leadership opportunities and effective networking. It adds value of resources in personal life. Some of the competencies that I discovered were implementing and sustaining change, changing the worst to the best, understanding self and others, communicating honestly and effectively, and mentoring and developing leaders. So we have references here. You can go through the references and see where I was able to get all my information. I hope you enjoyed my presentation. Thank you.